good evening, good afternoon. Welcome to everyone. We are delighted to have with us Miss Hadia Nusrat. She is a gender specialist from Pakistan, but also working globally. Her next assignment is in Somalia, and earlier she has worked in Philippines. And we are really happy to have her with us. And today she'll be talking with us about gender, disaster preparedness, and women's resilience in climate change mitigation. Welcome, Hadia.
Thank you very much. And it's a
And
pleasure
I
to
want to also tell you that today's session is sponsored by Women's International League for Peace and Freedom. It's a Geneva-based organization that we have been working with for many years. So we thank them. Yes, Hadia.
All right, welcome everybody. Sabko khush aamdeed. I will switch between Urdu and English because we have some international participants. So इसलिए अगर आपको कुछ अंग्रेजी की चीज़ समझना है मैं फ़ौरन ही उसकी उर्दू में तशरीह भी कर दूंगी. तो ये मेरा मुख्तसर सा तारुफ. मैं बहुत मशकूर हूँ कि मैं इस प्लेटफॉर्म पे मौजूद हूँ. आई एम रियली ग्रेटफुल टू बी एबल टू be at Poda's platform of Wednesday webinars.
तो हादिया आप मुझे क्वेश्चन करने की जगह देती रहिएगा.
Yes, of
Okay.
course.
So can you tell us a little bit about your background? What have you done before?
Yes, and indeed. Well, I'm a development and a humanitarian professional with almost 25 years of experience. Or in this experience, I have, in the last 5 years, I have 8 years, I have worked consistently in disaster-prone areas. So I've served in Afghanistan. Of course, Pakistan is a disaster-prone area. But also I have served in tandem for Bangladesh, for Syria, particularly the Palestine refugees in Syria. And so I worked with UNRWA, and I've worked with OCHA in disaster response at South Sudan, and most recently in the Philippines. And they're in two different cultural islands. I've served in the Muslim majority island of Mindanao, and I've served in Luzon at the eastern seaboard, where it's called the gateway of typhoons. So, and it's not a
Thank
joke.
you. And where are you heading now?
I am now heading to Somalia. So this is going to be
Okay.
another very
So
interesting experience.
we are very happy that you could do this webinar for us before going to Somalia. अंग्रेजी वाला लगा दें announcement.
Yes, this one.
So as is the tradition of our webinar, our participants keep on coming. So far, we have Miss Ambareen from Chakwal, and we have Alize Fatima from Islamabad, and we have Rahima from Rawalpindi, and we have with us our guest from Rwanda. So we welcome everyone. And Hadia,
Yes.
tell us about gender first.
Right.
Because that's a word that everyone uses, but not everyone understands and have different meanings. So tell us about that, and then we'll ask you to link it with the disaster preparedness.
Certainly. Well, you know, the textbook definition of gender is the power assigned to a male or a female based on societal norms, traditions, and practices. So I boil it down to gender is equal to power. So if you try and if you're confused about gender, just ask, so who has the power? Does this person have the power? And then you will notice the other features that maybe that person that you are examining is a woman. It may be an elderly man. It may be a person, a person with disability and a youth. So power is what defines gender. And gender is both men and women and the entire diversity between this binary. So everyone has different gradients of power. So power is the determinant of gender
थैंक
ascribed
यू.
by society.
उर्दू में भी बता दीजिए. सो
जी, मेरी सब बहनों के लिए कि जेंडर की मुझे तरबियत देते हुए अब कई साल हो चुके हैं. जेंडर को समझने का अच्छा उसूल ये है कि वैसे तो इसको किताबी तौर पे कहते ही हैं कि वो इख्तियार या वो रोल्स या वो सलाहियतें कि जिसको आपका माशरा, आपके रिवायात, आपका दीन इजाज़त देता है. दीन को क्योंकि आमतौर से दीन और माशरा जो है वो मिक्स हो जाता है, तो इसलिए यानी माशरे की दी हुई आपको प्रिविलेजेस, यानी आपको किस चीज़ क्या काम करने का आपको इजाज़त है और किस चीज़ से आपको ममानियत है. हुदूद भी माशरे की कायम करदा होती हैं. तो ये है जेंडर का किताबी तफसीर. लेकिन असल में अगर आप जेंडर समझना चाहें तो आप फौरन उसके साथ एक इक्वल टू मार्क लगा के उसके आगे लिख लें इख्तियार. कि जेंडर या सिन्फ असल में इख्तियार का खेल है. किसके पास ताकत है कि वो फैसला कर सके, कि वो काम कर सके, कि वो तालीम हासिल कर सके, कि वो अपनी शादी की अपनी मर्जी से कर सके. तो ये तमाम चीज़ें आपको जेंडर को समझाती हैं. अच्छा, जेंडर में ऐसा भी हो सकता है कि आप एक औरत जो कि नौजवान है, उसकी शायद इख्तियार या ताकत एक माजूर बूढ़े आदमी की निस्बत ज़्यादा होगी. तो यहाँ पे ये नहीं कह सकते कि जी मर्द जो है वो बाइख्तियार है और औरत का कम. यानी ताकत और इख्तियार को समझ के बात करना जो है, और उसमें सिन्फ और जिन्स दोनों को सामने रखते हुए इस बात का गौर करना है कि असल में जेंडर है क्या.
thank you, Hadia. So we have in front of us today's agenda of the webinar. So at 3 o'clock, we did welcome and introduction of the webinar. And now we are requesting all women to write the district before their name so we can see the district. And then we will explain the webinar and its link with Sustainable Development Goal, and then talk about climate and impact on women. That all will go on for about 20 minutes, 25, and then we will start having a conversation, question and answer, comments, suggestions, as we do every week. And in the end, we'll have a group picture. So, Hadia, please
Can I
take it
go
away.
ahead?
Yeah,
Thank you.
please.
So we will be linking to these SDGs. You will find the link yourself. Otherwise, we can discuss this in the question and answers. यानी ये सिनफी बराबरी, अदम मसावात में कमी और मौसमी तब्दीली से मुताल्लिक़ इक़दामात, इनके बारे में आपको पूरे प्रेजेंटेशन के दौरान भी मिलती रहेंगी, लेकिन फिर हम आखिर में भी इस पे बात कर सकते हैं. ये मेरा तारुफ चल रहा था. कुदरती आफात, इसका एक सिनफी जायजा. अच्छा,
तो हादिया, चूंकि आपकी प्रेजेंटेशन उर्दू में है तो आप बेशक अंग्रेजी में बोल लें,
चलिए
क्योंकि हमें
ठीक है.
उर्दू में तो नजर आ रहा है.
बस ठीक है, बेहतरीन हो गया. So, as you may know that hazards or natural disasters, although there is a school of thought which says there's no such thing as a natural disaster. यानी कि अगर कोई आफत आती है तो उसको कुदरती कहना इसलिए अच्छा नहीं है क्योंकि हर आफत को मैनेज करना चाहिए. Every hazard can be managed, and that's why calling it a natural disaster is not appropriate. It is because of the lapse in management that a disaster, a hazard becomes a disaster. So we know that natural disasters are occurring. They are occurring more due to climate change, and they magnify their effect. यानी इसका असर बहुत बढ़ जाता है when you are facing many kinds of weaknesses and vulnerabilities. आपकी क्या नातमागरी है, कितनी कमजोरियां हैं, कुछ आपकी रसाई महदूद है कि नहीं है. So when these two elements are in a multiplier, the magnitude of the natural disaster and the magnitude of your vulnerability, it will result in the impact or the risk that you are facing to be overwhelmed by this disaster, यानी आफत आपको निगल लेगी, इस चीज़ का खदशा और इम्कान है। आफत के बदतरीन असरात इस वजह से जाहिर होते हैं, ये आपके सामने, दिस इज अ फॉर्मूला। द वर्स्ट risks of disaster are created when a hazard in its full magnitude comes in contact with communities who have diverse vulnerabilities, and therefore it gives rise to diverse risks and impact. But this can be changed. This can be changed if we change the divisor, if we change the abilities, the strengths, the awareness, the mobilization of these communities. So if we can turn their weaknesses into strengths, if we can enhance the strengths, the weaknesses and the impact of the multiple of the disaster will become less. So what we have to do is increase the divisor, the denominator. तो उम्मीद है आपको भी समझ में आ रहा होगा, तकसीम का एक उसूल है कि लकीर के नीचे जितना बड़ा हिस्सा होगा उतनी ही हासिल तकसीम आपको छोटी मिलेगी। और हासिल तकसीम हमारे पास क्या है कि आप आफत से मुतासिर ना हो, कम से कम हो। तो दिस इज द फॉर्मूला फॉर डिजास्टर रिस्क रिडक्शन। रिस्क, ये बादल है on the left, this cloud shape on the left is the risk. Red is the hazard, because a hazard becomes a disaster when it is not managed. So remember, maybe you can increase your risk, your abilities to manage the hazard better so that it does not become a disaster. Here's a pictorial view of the same. You can recognize it's Pakistan on the top right corner. ये पाकिस्तान के सैलाब की तस्वीर है। Interesting picture I found on the web when I was searching of weakness. And you see two women who are, one is in a wheelchair, she's a person with disability, and the other is rolling her across. अब मैं चाहती हूँ कि मेरी बहनें ये भी गौर करें कि अगर यही औरत व्हील चेयर में गांव में होती तो क्या उसको पक्की सड़क मिलती कि जिसके ऊपर व्हील चेयर चल पाती। So just imagine that if this event, this picture of vulnerability was happening in a city, in a village, there would not be any roads on which a wheelchair could be rolled. So clearly, their vulnerability would have been enhanced had they been in a village. And on the left, you can see what happens to women. आप देख रही हैं वो खाना भी उन्होंने सर पे उठाया हुआ है, लकड़ियां भी सर पे उठाई हुई हैं, वो खुद भीग जाएंगी मगर लकड़ियों को भीगने नहीं देंगी। इट इज इम्पेरेटिव दैट द वुड does not get wet, because this wood means the meal that they will have tonight. So it's really important to look at the kind of vulnerabilities women face. Of course, men also face vulnerabilities, and that is where we have to understand the interplay of age, sex, ability, disability, etc. In the
This is
bottom.
so true, Hadia. You're showing the picture of these two women who are protecting the wood on her head because that wood is going to make food for her children.
Yes.
And in the 2022 mega floods in Pakistan, we saw the picture of a woman. In one hand, she was carrying her child, and in one arm she was carrying her child, and in the other arm she was carrying a goat. Both were equally important for her because the goat would give the milk to sustain the child. So that shows how important is environment and livelihood for women.
So true. Such a poignant picture, Samina. Thank you for sharing. So I looked and looked to find a picture which could show that how women in Pakistan get together to reduce risk. तो ये सबसे नीचे वाली तस्वीर पाकिस्तान की नहीं है। मैं ढूंढ रही थी कि कहाँ ऐसी मुझे एक पाकिस्तान की तस्वीर मिले जिसमें खवातीन अपने इलाके में आफत से आने वाली बुरे असरात को कम कर रही हैं। What you see in this picture in the bottom is from South Sudan, where I've served. And these are women, it's a mothers group. They are clearing the tarmac of an airport because they are disconnected from the rest of the world. The only way supplies can come in is through the tarmac. And they have got everybody helping. तो ये आपको नजर आ रहा है कि ये खवातीन जो हैं उन्होंने अपने साथ मर्दों को भी मिलाया हुआ है। और मुझे इसकी हकीकत इसलिए पता है कि मैंने इसकी पूरी स्टोरी लिखी थी कि इसके पीछे आपको जो नजर आ रही है जगह वो एयरपोर्ट की लैंडिंग की जगह है। और इनके इलाके की सब सड़कें मुनक़ता हो चुकी हैं। और उनके बच्चों के लिए और उनके लिए जो भी सप्लाईज आनी है वो उस एयरपोर्ट के रास्ते से ही आएंगे। अगर उस एयरपोर्ट के रास्ते में पानी खड़ा हुआ एयरप्लेन लैंड नहीं करेगा। तो आप देखें कि तंजीमी सलाहियत भी कितनी अहम है कि वो जो relief is ensured because these women decided to get together and make sure there's no water on the tarmac so that the airplane could land.
And those airplanes are probably bringing food and aid and other supplies. So that's why, maybe the women took the leadership. And it's amazing to see that sometimes it's very important for women to take the leadership.
Yes, yes, because
That's a
at a
beautiful
time,
picture.
thank you so much. At the time of a disaster, remember, everybody is facing chaos and confusion. Even if you think that the UN has got it all figured, it's not true. यहाँ तक कि हुकूमत पाकिस्तान भी सोच रही होती है कि हमारी तैयारी मुकम्मल है, लेकिन फिर क्यों हर बार सैलाब इतनी तबाही फेरते हैं? तो इसका मतलब ये है कि कोई भी हकीकत में उतना तैयार नहीं होता कि जितना होना चाहिए ताकि सैलाब या कोई भी आने वाली आफत की जद कम हो जाए। I want to show you a small video and I don't know how I've created this scratch on my Control Z.
It looks very artistic. Don't worry about it.
All right, watch this small video. Story of a village where Satya and Maria have a house. Satya has 2 children, Maria has 2 children too. Satya has a husband, Maria doesn't. Satya works in her little farm. Maria has a little vegetable plant. Maria goes a long way to the market to sell the vegetables. Satya has good news, goes to the market in a night they are hit by a big storm. Storm caused a lot of damages. So keep that video and the story in your mind. Keep the 2 characters, Safia and Maria, in your mind. And now remember what I told you, that so many different things can impact you. I think I showed you this picture before. These are all the aspects that impact a person, whether a woman or a man, a boy or a girl, person with disability, different types of disability, hearing, sensory, physical, and mental disabilities. They all exist within us, around us. Persons with different gender identities, Khaja Sara, trans, they also live with us. So these are all the things that make us different. Let's look at Safia and Maria. What do you think is their difference? So I've written down some, but we can always go back to it after in the question answer session. So Safia's house was at a higher level. Maria's house was closer to the river level. Safia had a husband, Maria didn't. Safia seemed to be a little more rich. Maria seemed to have less resources. Maybe Safia is a Muslim. So, keep in mind, always keep in mind there could be so many sources of power कि इख्तियार कहाँ कहाँ से आता है, ताकत कहाँ कहाँ से आती है. हो सकता है कि सफिया मुसलमान हो सकता है कि मारिया हिंदू या मसीही हो. Maybe Maria is either a Hindu or a Christian. Maybe Safia is more educated. Maybe Maria is less educated. You will not know these things unless the humanitarian assessment captures everything. इन सब बातों का पता जब आते हैं इमदाद देने के लिए लोग, तो उनको इन सब बातों का पता होना चाहिए कि ये अक़लियती घराने हैं, ये मुसलमान घराने हैं, घराने में कितने अफराद हैं. So just imagine if Maria also had an elderly mother-in-law who was in a wheelchair. Her wheelchair would have been sunk in the mud. है ना. अगर उस व्हीलचेयर पे उसकी अगर सास होती मारिया की, जो दरिया के नजदीक रहती है, तो उसकी तो व्हीलचेयर धंस जाती. तो कौन उनकी मदद करता. नाउ सम स्ट्रेंथ्स. maybe Safia is just a visitor in this land and she will have to go back after this destruction to her city. Maybe Maria is part of a big clan and they will come and help her. So ये भी लोगों की ताकत और सलाहियत होती है कि उनके साथ कितने लोग, कितना कबीले की ताकत मंसूब है. So it really depends. If you have the social capital to recover, you will be faster at recovering. What are the things that increase your vulnerability? So in Pakistan's scenario, think about how can we reduce our vulnerabilities? कमजोरियां कैसे कम करें? सैलाब से बचने के लिए क्या जानना चाहिए हमें? क्या आपको वो मालूमात है, या हर साल सैलाब आता है और हर साल आपको लगता है कि हम उतने ही मालूमात हमें हासिल हैं कि जितनी पहले थी? क्यों नहीं आपको और मालूमात हासिल? ये मालूमात आप हासिल करना आपका हक है. It's your right to be able to get updated information about the disaster that is approaching if it's floods. What makes you weak during a floods? If you've lost your documentation. So what can you do to prepare? Keep your documents already prepared in a plastic bag so you can just grab it. Even better, put it in a bag so you can just grab the bag. उस बैग में और क्या चीज रख सकते हैं अपने जरूरी कागजात के अलावा? मोमी लिफाफे में बंद करके अद्वियात रख सकते हैं. You may need medicines. You may need baby food. Keep a bag ready. It's called a go bag. And every household in the flood affected area in Pakistan should already know this. Now, after 2010 floods, 2011, 2012, then again in between, and I came back in 2022 to serve the floods. Again, there's floods this year. हमें ये सबक सीख लेना चाहिए ना कि हमें किन चीज़ों की हिफाजत करनी चाहिए और क्या चीज़ें हमारे पास होनी चाहिए कि अगर खुदा ना खास्ता सैलाब आ जाए. Also keep some money aside. I know it's very difficult when you are a poor household. There is no money to be spared. But you know that you need the money to pay for a tractor and a trawler that can carry your elderly, maybe your goat, maybe your persons with disabilities. So, and they charge big money. They all charge a hefty amount once the disasters have struck. सबको पता है कि कीमतें बढ़ जाती हैं सैलाब के बाद. तो क्यों ना कुछ पैसे जोड़ के रखें, गुल्लक में रख लें, मगर उस गुल्लक को उस बैग में रखें ताकि आप वो बैग पकड़ें और भाग सकें. And we will talk about at the end, what can you do? I just have these few ideas. I'm one person, very small. I've never faced a flood. I've only gone in after a flood. So those who have faced a flood can exactly tell what they needed, what they wished they could have salvaged from their house, and what was not important at that time.
Hadia, this is a very good list. And I see that on the other side, you have it blank and you're asking the women,
Yes.
what can you do and what can they add? So do you think we could go to the women and just
Yes.
take a few suggestions? And I also want to take this opportunity to welcome Dr. Mumtaz Esker. She is a medical doctor and a specialist on reproductive health issues. She is a PODA's board member. So we are very happy that she could join us today. And I also want to welcome Advocate Rakshanda Naz from Peshawar, Khyber Pakhtunkhwa. She was recently provincial ombudsperson for the protection of women from harassment at workplace. Welcome, Rakshanda. And I want to tell you that we have representation from 16 districts of Pakistan. And we have Jamshoro Sindh, Gilgit Baltistan, we have Chakwal from Punjab, we have Gujarat, we have Multan. And as more news is going to spread about this wonderful webinar, you'll see more joining. Usually there's a rush in the last half an hour. So would anyone like to add to Hadia's list?
Yes, I'm
What
ready.
else should we do? You can raise your hand or you can open your mic and speak. Tell us
I'm
one more thing that you should have in that go bag. जो मुसीबत के वक्त में आपने बैग लेके भागना है उसमें और क्या चीज होनी चाहिए
कुछ हैं हाथ जो खड़े हुए हैं? I'm sorry, I can't see them. Wajid will just.
Yeah, I can't see the hands, but someone can open their mic and give a
Okay,
suggestion.
no hands, no hands. Samina, maybe you want to break the ice.
Well, I would keep a torch, you know,
Oh, very
because at nighttime you need a torch. Now everybody has cell phone and cell phone has light, but when you're in disaster, maybe the charger will go away.
yes.
And I like to keep a torch in my bag all the time, actually. So anything from anybody, please, the floor is open if anyone wants to add something in this list.
Okay, so let me just put this in. What can you do?
Okay.
So Control V. So you'll have a torch. What can you do? So this category is asking, what can you do? So think about, these are the things that can make you vulnerable. These are your vulnerabilities, that you don't have information. So you don't have your documents. You're without your medicines. What else? Okay, now I've lost my spelling ability. MEBIC. हाँ, okay, नसरीन, आप क्या ऐड करना चाहती हैं? अनम्यूट
जी
करें
अस्सलाम
अपने आप को।
वालेकुम।
वालेकुम
जी
सलाम।
अस्सलाम वालेकुम। बहुत बहुत अच्छा और बहुत टॉपिक है जो दिल की बात से है, तो बहुत थैंक यू वेरी मच ऑल द पौधा टीम एंड ऑल द मेंबर्स। बस मैं सिर्फ ये इसमें पूछना चाहूंगी कि जिस तरह से हम सिनफी नुक्ता नजर से कुदरती आफात की तैयारी में हम बात कर रहे हैं, तो जो तौलीदी सेहत है और हम जब डिजास्टर मैनेजमेंट की बात करते हैं या रिप्रोडक्टिव हेल्थ के बारे में, तो ये भी डॉक्टर साहब ज्वाइन कर चुके हैं, वो हमें बहुत अच्छे से बताएंगे। लेकिन जो हमारी लीडरशिप होती है उसमें जो फीमेल का रोल होता है, तो इसको बहुत ज्यादा एक्टिवली वो करना चाहिए, क्योंकि जब भी डिजास्टर आता है, तो ये मेरे साउथ पंजाब से मेरा ताल्लुक है, तो वहां पे मैं आपको बताऊं कि साउथ पंजाब में जब भी किसी किस्म की एड, इवन के कैंप आ जाए या कुछ खाने पीने की एशिया आ जाए या कुछ भी आए, तो वो वहां तक नहीं पहुंचती जो विक्टिम्स होते हैं, जो जिनको चाहिए होता है। तो जो फीमेल है उनका जो रोल है उसमें बहुत ही जिसे कहते हैं कलीदी किरदार है। तो इसके ऊपर हमें ट्रेनिंग करनी चाहिए, इसके ऊपर हमें बहुत ज्यादा तवज्जो करनी चाहिए कि खवातीन इसके अंदर बहुत मेन रोल प्ले कर सकती हैं, क्योंकि वो जो खवातीन होती हैं बच्चों को भी उन्होंने लुक आफ्टर करने थे, मेल जरूर उसको फैसिलिटेट करते हैं, जानवर भी लेके जा रहे होते हैं और शिफ्टिंग में भी होते हैं, लेकिन फीमेल के ऊपर बहुत सारी जिम्मेदारी होती है। खवातीन के स्पेशल डेज भी उसी में आ जाते हैं, उनकी अगर वो हामला है तो वो भी आ जाते हैं। तो इस मैनेजमेंट के हवाले से थोड़ा सा अगर आप रोशनी डाल दें।
ठंडा कर दो मुझे
Nasreen,
पसीने।
very important point. जी
Yes,
हादिया।
Bilkul, I have written this. So, what can you do? Ensure that female doctors should play a role on health, but maybe you can mobilize female doctors. What can you do? Nasreen, can you do that? Be mobilized? के
यस
सेल आने वाला है। थैंक यू। सो taking responsibility. गो बैग बनाना भी एक रिस्पॉन्सिबिलिटी है कि
यस
ये किसी के पास ये रिस्पॉन्सिबिलिटी होनी चाहिए कि गो बैग बनाएं, उसमें टॉर्च डालें, मेडिसिन डालें, डॉक्यूमेंट्स डालें।
But
सो
Hadia, can I ask you something?
यस
Because, doctors are already very, very busy during a disaster, and
यस
countries like ours don't have enough doctors. So
ऑफ
doctors are
कोर्स।
very busy. So, who else can help in such a situation?
लेट्स आस्क द women. अगर
Like in
डॉक्टर
the medical field, who else can be helpful, or who else can be trained in non-disaster months?
yes
So when there's a disaster, they're ready to help.
Because it is the preparation of disaster is the
Yes,
yes very good. So if female doctors are less likely to be of assistance, who else?
because they're
बताइए।
already so busy.
Yeah.
already the female doctor is not available in those days in disaster, because they occupy in the THQ, BHU and other sites,
But
health facilities. And but in the field they are not medical assistants in the field, because the female in suffer in houses, in the villages, in the rural areas. So what can I do?
Also speak with midwives and paramedical staff. Maybe you can even talk to senior lady health visitors or senior lady health workers, that they remain mobilized to help women's menstrual and reproductive health needs during that time. क्या हो सकता है? Is it possible? It can be done through Pauda's webinar.
मैडम ये तो फिर पैरामेडिकल स्टाफ में ही आ गया ना, जो हमारा गवर्नमेंट का स्ट्रक्चर है, ये मिडवाइफ, कम्युनिटी मिडवाइफ, ये तो पैरामेडिक्स में आ गया, एमटी हो गई है। लेकिन कुछ ऐसा भी सिचुएशन होती है कि जब वो बीएचयू पे या जो कैंपिंग होती है वहां पे वो बाउंड हो गए, जो हमारी पेरीफ्री एरियाज हैं जहां पे इस तरह की सिचुएशन होती है, तो उसकी बात मैं कर रही हूँ। शायद मैं
I,
अपना सवाल एक्सप्लेन नहीं कर रही, तो मैं
I,
मैडम समीना नजीर से
I
कहूंगी कि
understand.
वो इसको एक्सप्लेन करें कि मैं क्या पूछना चाह रही हूँ।
नहीं, आपने बिल्कुल अच्छा सवाल किया, Nasreen. Your question is very clear. And, maybe retired nurses can help. And that's why I say to people that, we should all do first aid courses, because you never know when disaster will hit. So if all of us know first aid, then we could also help. And also, have supplies of menstrual hygiene and other things ready. But we be aware of the cultural values. When the 2005 earthquake happened in Kashmir, we went there and we took so many sanitary pads. And when we gave them to women, the women said, "What are these? Why are you giving them to us? What are we
Yes,
going to do with them?" When we
yes,
explained to them, then afterwards they said, "Where are we going to throw them? We don't want anybody to see them." So there are other issues. And of course, a lot of the aid that we took caused a lot of pollution there, because there was so much plastic and everything. So there's a lot of thinking that goes into these planning.
So
So I think we made a good list. Should we move forward?
Yes, certainly. And
Oh,
I'm
sorry,
going
one
to add
last
it.
thing somebody wrote, so I'm
Yes.
just going to read it.
Chanda also had a hand.
Inheritance and property papers.
Yes, documents, definitely. So documentation including inheritance.
And that also during the earthquake, many women, when they went to claim to get the compensation, they had no inheritance papers because in the families, it's usually the men who keep the papers. And a lot of men died because they were outside.
Yeah.
So it became very problematic. Ji, Rakshanda Naz has done
Rakshanda, you had your hand
excellent
up.
work on inheritance. Would you like to add something?
Thank you, Samina. Basically, my input is related to the previous discussion because when we were talking about the list, so because I extensively work in 2010 floods and then in 22, so there are one common issue where people are not prepared for snake biting because in a flood,
Yes.
so I think in the list there should be a very thin string should be part of that package as a first aid, and the second thing is some sort of blade or anything to cut that place of snake biting can be used. So I think this is one should be know, particularly the areas in DI Khan and in I was in Muzaffargarh.
Everywhere, everywhere.
Everywhere you can
Yeah.
have this problem. And the second thing, because the one thing we realize, we get very active during the flood. No doubt, humanitarian response is very important. But I think the one thing we need to focus on, because the government of Pakistan commitment to establish district disaster management units. So I think because this program is related to the rural women and they are the most affected population, they should start advocacy campaign to uh, get their district disaster management unit as functional as provincial level they have. So I think we should take up this issue with provincial disaster management like PDMAs, NDMNAs, NDMAs. So I think this is very important activity for all of us because if our district disaster management units are active at the district level, there are less chances of disaster at the district level because their responsibility is to create awareness to have more trees at the ground and the other mitigation measurement.
Rakshanda, that is
They are
excellent
taken.
because you
Wow.
are suggesting both immediate, short-term, and also long-term
Yes.
long-term solutions like planting more trees. So,
Yes.
Hadia, it's DD,
DDM.
District Disaster Management Authority.
PDMs.
It's A,
Okay, authority.
DDMA.
DDMAs.
And what
Yes.
is this last line? Prepare DOH. What is D?
Department of Health. Department of Health to ensure availability of remedies.
Oh, okay, Department of
Cascade to remote
Okay.
areas for snake bites and rabid dogs. I
Oh,
don't know
okay.
if rabid has two
Yeah,
B's.
I just didn't understand DOH. Okay, excellent contributions. So, oh my
Okay,
God.
thank you so much. And look, I'm sorry about this, but this is a table that I kind of asked ChatGPT AI to make it short for me. But basically, it talks about remember your rights. In a disaster, it is most essential that you remember your rights. Remember that you have the Constitution promises that you have equal constitutional rights. So remember that, and do not be afraid, even though you are being inhibited by your social and cultural norms. ख़वातीन ये याद रखें कि मसावात की यकीन दहानी आईन पाकिस्तान करता है. So please use that कि अपने आप को कम ना समझें. कानूनी बराबरी औरत को और मर्द को हासिल है. Men and women are equal in the eyes of the law. Then the right to education. So this is something that weakens everybody, both men and women, but women in particular, because they lose out due to several reasons: menstruation, drop out of school, lack of resources, the boys preferred to go to school, etc., etc. I can just schools are not in the region for higher studies, only primary schools are available, etc. So these are the rights. You have the right to education. If you have education, you will be better equipped to learn about how to prevent disasters at an individual level, at your family level, at your neighborhood level, and at your community level. You may even have the advantage to lead if you have education. सेहत का हक, जो कि अभी बात की थी हमारे कॉलीग ने, that maternal health and menstrual hygiene are both very important, and they need to be prioritized and they need to be prepared for. ये सिर्फ उस वक्त ख्याल नहीं आना चाहिए जब डिजास्टर्स आ जाएं, बल्कि उससे पहले तैयारी का हिस्सा होना चाहिए. And that तैयारी isn't just a go bag. It's also speaking to the district disaster management units, saying this is what we face every time. We need privacy and dignity in accessing menstrual hygiene and reproductive services. So if you make this very clear at the time before the disaster strike, you will have their ear, and you can also volunteer your own support for it. सेहत का हक, तहरीक और अंजुमन की आज़ादी का हक, यानी तंजीम साजी का हक, ये आपकी इजाज़त है, आपको इस चीज़ की इजाज़त है. समाजी रवायात रोकती होंगी. Maybe you do not enjoy the right of association and mobility and mobilization. And we also know mobility is hampered because of social cultural aspects, but you can mobilize, and this is a human right that you enjoy. जायदाद और विरासत का हक, very important that you keep your documents of inheritance if you have them. If you don't, remember, even in non-crisis times and in crisis times, you need to be aware that you have a right to inheritance, and do not give it up under social and cultural pressures. हम लोग अपने भाई के दबाव में आके या माँ बाप के दबाव में आके भाइयों को विरासत दे देते हैं. इस किस्म का प्रेशर ना अपने पे लिया करें और अपने हक के लिए बात किया करें. इसी से हमारे आगे बेटियां और बेटे सब इस बात के बारे में समझदार होंगे that a woman and a man have distinctly different they have the same rights and no one should overpower the other. तशद्दुद और इम्तियाजी सुलूक का तहफ़्फ़ुज़, we know that we are facing discrimination and violence. That is an unending saga, it seems, for Pakistan. But you can prepare so that you are not at the wrong place at the wrong time. Of course, that helps. That you are aware of how to protect yourself. You are aware of how to fight back, to make a noise. And when people say, shush, don't talk about it, you are aware that you have the right to speak, and there is somebody there to help you. And so when we talk to the disaster district management authorities, this is also something you always say, it goes uncovered. ख़वातीन और बच्चे जो माजूर हैं, वो गैर माजूर अफराद से ज़्यादा जिनसी तशद्दुद का रिस्क रखते हैं. उसके ऊपर उनका ज़्यादा खदशा और ख़तरा है कि उनके साथ जिनसी तशद्दुद हो. क्यों? क्योंकि वो मजबूर हैं, वो चुप कर जाएंगे, वो नहीं बताएंगे और तशद्दुद का शिकार होते रहेंगे. सियासी अमल में हिस्सा लेने का हक. When you vote, ensure your vote is registered. When you vote, make sure you are voting for someone who has your ear. किसी ऐसे शख्स को मत नुमाइंदा अपने इलाके का नुमाइंदा बनाए कि जिस तक आपकी आवाज़ ना पहुंच सके। औरतों को इस चीज़ के बारे में ख़ास तौर से मालूमात होनी चाहिए कि एक अच्छा लीडर तकदीर बदल सकता है। हमें पता है, वी आर लिविंग थ्रू एन एरा वेयर वी विश द गवर्नेंस वाज बेटर। And last but not least, you have the right to justice, इंसाफ. It is in your constitution. आइन कहता है कि बराबरी का हक, इंसाफ का हक है. Unless you raise a complaint, you will not be able to ask for justice. So raise your voices. And this is preparedness not just for disasters, this is preparedness for life in Pakistan. Coming to the ending now, I just want to give you all, ये अंग्रेजी में है, इसका मैं उर्दू बना दूंगी, but this is what.
So, Hadia, I'm sorry to interrupt you, but your last point was you have the right to complain.
Yes.
You have the right to complain and, say that. So, are there any complaint mechanisms that
Very
we
good
can
question.
use? Because we all need to know where are the complaint mechanisms.
That is very good. That is a very good question. Yes. As a matter of fact, when we look at what the UN holds as their standard, यानी United Nations और तमाम जो उसके साथी हैं, यानी जो लोकल तंजीमें हैं, जो इंटरनेशनल तंजीमें हैं, वो सब इन 10 उसूलों के पाबंद हैं. And one of them is the right to complaint. तो इसमें आप देखें H जो है, that says feedback complaint mechanism, and it comes in the area of influence, but these are the gender and age marker, or every funding is marked against these 10 indicators. So if these 10 indicators are not strongly mentioned, donors should technically not give them money. They should be disqualified at country level. It shouldn't even reach the eyes of the donor. But this is a weakness in our country, UN system, and even other, because it's not just through the UN that we get money. We get money directly, like CARE International give money directly to CARE in Pakistan, Plan International. I mean, I don't know which other INGOs.
Yeah, so Hadia, as you know, this is a very painful topic these days, the aid one, because everyone's aid is finishing.
Exactly.
Plan International doesn't work in Pakistan anymore, and other sources are very limited. I was referring to local complaint systems. Perhaps we can ask Rakshanda, since she was an ombudsperson.
Yes,
What
please,
are
Rakshanda.
some of the complaint mechanisms that we can use locally in Pakistan?
Thank you, Samina, because during the disaster period in every province, the rescue 11 is always 1122 is get active even in the normal days. So this number is permanent number, and people can contact there. And then all the PDMAs, they have their helplines. And the thirdly, during disaster, in terms of flood or earthquake, always the deputy commissioner's offices, because each deputy commissioner office now have assistant commissioner designated for as relief and human right contact focal person. So I think we should have a list of focal person from social welfare, from deputy commissioner office, from PDMA office, and the rescue 1122. This is one of the best option for a person stuck in any disaster, because last year in Kalam, I helped some of the people there. They were stuck in the family through the deputy commissioner's office. So their help lines are always very active and responsive. So I think we should have this list of contact people in a normal days as well.
Yes, well.
That's excellent point. I want to welcome some more members. We are very happy to see Hira Imam, our old member, seen her after many weeks. So welcome, Hira. Also, we have with us Miss Azra Memon. She's the head of Nari Development Organization in Dadu, and she actually works very closely with district authorities. So, Azra, I would like you to say a few words, add to what Rakshanda has said. From Lahore, I want to welcome Kamal Vakar from International Water Management Institute. And then if I'm missing anyone, I'll keep on welcoming you. So Azra, and then maybe Kamal, if you want to add something. Azra? What should be the referral mechanism, key offices, numbers that we should have? जी अजरा
जी मैडम हमारा अस्सलाम वालेकुम, आवाज आ रही है मेरी?
जी जी
जो हमारा जो जीबीवी पे हमारा जो कंपोनेंट है रेफरल मैकेनिज्म का ये है कि मैं जो हूँ मुख्तलिफ हमारा इदारा है वो जो डिस्ट्रिक्ट कमिटीज हैं उसके मेंबर ही हमारा इदारा नारी, उसकी नारी की तरफ से मैं मेंबर हूँ। जो भी वुमन प्रो वुमन लेजिस्लेशन लॉ है तो उस कमिटीज की मैं मेंबर हूँ। अब कुछ केस हरासमेंट के जो भी केस होते हैं, अभी एक रेप केस हुआ था एक फार्मर वुमन की उनके साथ, तो हमने उनको प्रोटेक्ट किया था और जो है ना उसमें उस केस को हमने रिफर किया था दादू जो है वुमेन प्रोटेक्शन जो सेल है वो है वहाँ पे SHO है, SSP साहब हैं, तो उसमें ऐसे भी केस आते हैं और उनके साथ जो हमारे जो काफी खवातीन हैं जिनके वो CNICs नहीं बने हुए होते हैं और काफी वो केसेस भी हैं जिसके जो मिल्कियत में जिनका हिस्सा है, तो यहाँ पे जो रेवेन्यू के जो मतलब अमला है या जो फ्यूडल सिस्टम है, तो उस खवातीन को वो फौती करार देके उसको फौती खाता बनवा के फिर उसको डेथ मतलब उनको डेथ करा देके तो मतलब जैसे उनको मालकाना वो हक नहीं मिलता, तो ऐसे भी काफी एप्लीकेशन हमारे पास आई थी। एक खातून थी, उनको अपने भाई ने फौती करार दिया हुआ था, जब वो उनके बेटे ने रेवेन्यू का रिकॉर्ड मतलब ओपन करवाया तो उसमें उसका वो फौत हो चुकी थी, उनका डेथ सर्टिफिकेट भी था। फिर वो हमारे पास आई तो हम ये जो केस है जो ह्यूमन राइट हमारा सेल है डिस्ट्रिक्ट दादू का उसका चेयर है वो DC साहब है और हम उसके मेंबर हैं। तो ऐसे जो केस है और कुछ जो नादरा के इश्यूज होते हैं, CNICs के इश्यूज होते हैं खवातीन के, उनमें कोई मिस्टेक होती है या कोई मतलब डॉक्यूमेंटेशन के मसले होते हैं या इवन RTI राइट टू इंफॉर्मेशन के जो इश्यूज होते हैं, तो हमारे जो डिस्ट्रिक्ट लेवल की कमेटीज हैं तो उसमें मैं मेंबर हूँ, तो हम केस जो है ना वहाँ फॉरवर्ड करते हैं। उसी कमेटीज में है हमारे वुमेन डेवलपमेंट डिपार्टमेंट है, सोशल वेलफेयर भी है और उसमें गवर्नमेंट की तरफ से एडवोकेट भी हैं जो
ठीक है
वो उनको
जी अजरा, बहुत शुक्रिया आपका, बहुत शुक्रिया. You have mentioned the key departments that we should know and we should have their numbers and names. Or I think I mixed up Kamal from WaterAid with Kamal from IMWI. So please, Kamal, tell us which Kamal are you?
Assalamu alaikum ji. This is Kamal from International Water Management Institute,
Okay,
Lahore.
so I was right. Yes, Kamal, what would you like to add?
Thank you very much, Madam Samina. Once again, congratulations for picking up this very important topic for discussion. And I joined a little late, but this topic is very important to discuss. We are working very closely with the communities affected by flood in Punjab. and in other areas. So the point is that our DDMAs, our PDMAs, they actually, I'm sorry to use this word, but they actually don't have this awareness that what is the gender risk and what kind of gender response is required to those communities, to those people. And when they don't have this understanding, how they can help them to overcome this challenge. So again, we mentioned about a lot of platforms where we can contact, or those communities can contact during disaster. But the problem is, when we are talking about the women, when we are talking about the people with disabilities, when we are talking about the children, so they don't have even access to a mobile phone. They cannot use the mobile phone. They don't have access to the mobile phone. They don't have this awareness that during this disaster, these are the helplines where we can contact and where we can ask for the help. So the first thing is that the lady just before me mentioned about having a local communities over there, local organizations over there, local women groups over there. So it's they're like they can play a pivotal role not on the time of disaster, but before disaster. Go to those communities, talk to those people, tell those women, to those youth that look, these are the channels. You can contact us through this way. So I mean, we really need to look into the realities of those people, vulnerabilities of those people, and then propose the solutions. Thank you.
Thank you so much, Kawal. And if I go back to the slide very quickly, you will see that this covers all the corners. It says that in the design phase, this is at the time when you are trying to respond to disasters. Ensure that you are analyzing the different risks and vulnerabilities and needs of persons. So men, women, boys, girls, persons with disabilities. There are 4 different types of disabilities and ranges in that. And also keep in mind persons that are excluded, like marginalized groups, LGBTIQ, trans, minorities, that they are all measured. Now, when you say measure, it means that they have a column to themselves. They are not just put into the language. And we have also served marginalized communities and minorities. No, we need to know how many minorities. Are they more vulnerable than the others? Or are they like Maria, more connected? Because they are minorities, they are more connected and they can help safeguard each other. So we really need to know the disaggregation, not just by sex and age, but also by the various diverse components that intersect. And that's why this is an intersectionality analysis. And when you do an intersectionality analysis, you can come up with the different risks. What is the differential risk? You can understand differential risk even before a disaster. किसी भी आफत के आने से पहले आप अपने मखसूस तहफ़्फ़ुज़ के खदशात जो हैं वो पहले से समझ सकते हैं. क्या मेरा घर नीचाई पर है, ऊंचाई पर है, कच्चा घर है, पक्का घर है, ये सब चीजें, all of these aspects will tell you how at risk you are. The second thing that you must do in the design phase is ensure that once you have the information, without the information, do not make activities. Do not start responding because you will be wasting your money. Respond in a tailored way. Give people what they want. I'm just coming from the Philippines. In the Philippines, women asked in a hygiene session, can you also just give us a bucket? You've given us toothpaste and soap and washing powder, etc. But if you give us a bucket, it can help us bathe, wash our clothes. We can use it to carry things. यानी खवातीन ने फिलिपाइन जैसे मुल्क में, और अगर आप खबरें देखती हैं तो आपको पता होगा वहाँ हमेशा घुटनों घुटनों पानी आ जाता है जब भी बारिशें होती हैं. उन्होंने जब उनको हाइजीन किट्स मिली तो उन्होंने कहा कि हमें सिर्फ एक बाल्टी भी और दे दें ताकि हम अपनी चीजें उसके अंदर रख सकें, हम कपड़े उसमें धो सकते हैं, हम उसकी मदद से नहा सकते हैं. वो बाल्टी उनको ना मिली. बकेट नेवर रीच देम. So that is what tailoring means, that you give them what they have asked for, what they need. The next aspect is influence. Now, influence is what you can build even now. आप अभी से अपनी advocacy, अपनी आवाज उठाना, लोगों को मुतवज्जे करना कि जी डिजास्टर आएगा. जनवरी के महीने में अगर आप कहें कि जी जुलाई में जब मॉनसून आएगी तो उससे पहले अपनी सलाहियतें इंप्रूव करें, हमारी तंजीम साजी अच्छी होनी चाहिए. We should have community groups, those supporting persons with disabilities, those who can help when we want to call a helpline without any loss of privacy or dignity. So influence, मुतासिर करने की सलाहियत, that needs to be strong. Benefits, जब disaster का रिस्पॉन्स हो जाए, मेक श्योर कि सबको यकसा बेनिफिट मिला है कि नहीं, सबको यकसा फायदा हुआ है कि नहीं. मेक श्योर दैट द benefits are equitable. It is not that some groups have benefited more. And I'll give you an example. In Pakistan, when um, agricultural response is done, women are just given a small bag of vegetable seeds. And they say, you make kitchen gardens. And men are given agricultural equipment and training and bags of fertilizers. That is not fair, and that is not right. Make sure that women are able to get as much benefit. If you are just giving them a bag of seeds, then give them a method to sell their produce in the market, not just to eat at home. Give them entrepreneurial skills, give them literacy and numeracy education so that they can run a little corner shop and sell the food. Because we know when a woman brings money into the house, it goes straight to the children and the family, which is not the case for men. So when you are monitoring, ये तो design हो गया ना, फिर आती है जवाबदेही. Monitoring क्या चीज़ है? It is accountability. When you come to the accountability part, your data must show that you have listened to everybody and you have them all disaggregated by sex and diversity, sex, age, and diversity. That when you tailor activities, you should know that there will be gender-based violence. Kahin bhi, already in Pakistan, even without a crisis, there's gender-based violence. In a crisis, it increases. So make sure that GBV is part of your tailored activities. In influence the feedback mechanism. Make sure that the mechanism works for you. कि जी वो उस नंबर पे कॉल कर लें, उस नंबर पे कॉल करके अगर आप कहें कि जी हम अभी ये जो फ्लड्स आए थे उसके नहीं नहीं हम फ्लड से नहीं बात करते, वी टॉक अबाउट GBV. अरे भाई फ्लड्स की भी तो हमने कहीं कंप्लेंट करनी है. सो यू शुड नो द एग्जैक्ट नंबर्स for complaining about distribution of aid, complaining. And this is a question you can ask when you receive a packet of food or a bucket or some hygiene equipment. Say, is there a number that I can call if I want to complain? Every woman, educated, uneducated, every recipient should know that they have a right to complain. तो ये चीज जरूर मालूम करें. कम्युनिकेशन विद कम्युनिटीज ये भी बहुत जरूरी है. दिस हैज टू हैपन प्रायर टू अ डिजास्टर. योर इन्फ्लुएंस इज एक्चुअली योर प्रिपेयर्डनेस स्टेप्स. एंड व्हेन यू लुक एट बेनिफिट्स, ये बहुत से ह्यूमैनिटेरियंस ये करते हैं कि एक डिजास्टर साइकिल गुजर जाता है तो बैठ के कहते हैं व्हाट वेंट वेल, व्हाट डिड नॉट गो वेल, क्या अच्छा हुआ और क्या अच्छा नहीं हुआ. तो उसमें सेटिस्फैक्शन हम ना सिर्फ उनकी पूछते हैं कि जो ये काम कर रहे थे, बल्कि ये कि जिनकी हम खिदमत कर रहे थे उनकी कितनी सेटिस्फैक्शन है, हाउ सेटिस्फाइड आर दे. एंड यू हैव टू लर्न कि ये हमने सीखा, अगली बार ऐसा नहीं होगा. दिस विल नॉट हैपन अगेन, दिस मिस्टेक विल नॉट हैपन अगेन, वी लर्न फ्रॉम इट. बट डू वी डू दैट? Every year we are as unprepared as ever before towards floods. So coming to the last slide, what are the kinds
Nadia,
of...
before we go to the last slide,
Yes.
I want to welcome a few more guests. I told you more will come in the last half an hour. We have our women leaders from Baluchistan, Sajida from Kachi district and Aksa, and also we have from Chichavatni, Sugra Banu. Who else is new? Sorry, I have to move the slide 2 times. To Sadaf from Hyderabad and Zaka from AJK. So, and Talat from Sialkot. Thank you, Talat. You've done great sessions on child marriage issues. So, I'm sharing the names of our guests because all these women are doing tremendous work in their district. Right now, there's a heavy flood in Tonsa barrage and parts of South Punjab, and we know that women are really working hard to make sure the communities are safe, and they are particularly focusing on the needs of women with more multiple disabilities, as you have mentioned. From Lahore, we have a very active member, Ms. Shamim, and then we have PAUDA members, Rahima, Kashaf, and if I miss anyone, I'll come back to them. Okay, so the last slide
Last slide.
is
What can
Salahi.
you do?
Yeah, you have
सलाहियतों
to
को
translate
मुतासिर
this. Very
Sorry, and my Urdu spelling is really
very
bad.
good Urdu, so please translate.
My spelling isn't good. सलाहियतों को मुतासिर, और मैंने गलत इमला लिखी हुई है, करने वाले अवामिल क्या हैं? What are the factors that impact our abilities? When I told you na कि under the divisor, the denominator is your abilities. If you can enhance your abilities, you can reduce your risk. So we are still looking at the idea of the little video that we saw, that keeping that in mind, how can we enhance the abilities? Okay, even if you haven't seen the video, how can we enhance our abilities? सलाहियतें कैसे बढ़ाएं? I'm sorry, my spelling is bad. और my site is also bad. मालूमात हासिल करें. अगर कम तालीम है तो ज़बानी मालूमात हासिल करें. तंजीम के साथ अपनी आवाज़ उठाएं, किसी तंजीम के साथ मुंसलिक हो जाएं, हुकूमत के मुतालिका अदारों की खबर रखें कि वो क्या कह रहे हैं. सो enhance your knowledge and your information, and if you are unable to read the information, ask somebody to tell you what is the latest on the disaster, the floods or the monsoon preparation in July. Even if it is the month of December, talk about it. तंजीम के साथ अपनी आवाज़ उठाएं. Find a way to be part of a social organization, any social organization. And if you are the first woman in that social organization, bravo to you. Bring in more women, because what everybody needs to do is hear each other's voices and find out what the government is doing. What are the disaster authorities doing? Are they giving any trainings? Wow, that will really raise your capacity. ये जाने कि कहीं कोई trainings तो नहीं मिल रही. First aid की training मिल रही है, reproductive health की training मिल रही है, इसकी इन्फेंट केयर की ट्रेनिंग मिल रही है, साइको सोशल केयर की ट्रेनिंग, क्योंकि जो चीज़ हम भूल जाते हैं, हम सब जहनी तौर पे इस कदर गमज़दा और रंजीदा होते हैं फ्लड्स के बाद कि हमें साइको सोशल सपोर्ट की ज़रूरत होती है. ट्रेनिंग्स लें ताकि आप ज़्यादा से ज़्यादा आफात में अपनी सलाहियतों को इस्तेमाल कर सकें. सो वी कैन ऑल्सो फिल दिस. कैन एनीबडी थिंक ऑफ एनी अदर थिंग कि सलाहियतों को कैसे बढ़ाएं? अगर कोई हाथ खड़ा करेगा तो
Yeah,
मुझे.
Azra, I would like to ask Azra to share. She has been doing a lot of work recently, helping communities from heat wave, because we have flood, but we also have heat wave. So Azra really is a person I've seen who has really increased her capacity in many ways. तो बताइए Azra. Or anyone else, what other?
जी मैडम.
जी
जी
पूरा सवाल तो करा.
मैडम, वो क्वेश्चन आप थोड़ा सा रिपीट करें.
मैं ये
हाँ,
आप ये देख रही हैं ना, ये पूछ रही हैं कि हम औरतें अपनी सलाहियत कैसे बढ़ाएं कि जब कोई डिजास्टर आए तो हम बेहतर काम कर सकें, जैसे मालूमात हासिल करें, तंजीमों के साथ काम करें, हुकूमत के साथ. तो आपने अभी जो मुख्तलिफ इदारों के साथ काम किया है, तो आपकी कौन कौन सी सलाहियतें बढ़ी हैं? जैसे कि मुझे पहले नहीं पता था कि हीट वेव में कैसे लोगों की मदद करते हैं, वो आप बताइए.
जी मैडम, एक तो हमारी डिस्ट्रिक्ट गवर्नमेंट के से लेके जो कम्युनिटी तक है, हमारी अच्छी नेटवर्किंग है. ٹھیک ہے. اور وہاں پہ ہمارے کمیٹیز بنی ہوئی ہیں. ہیٹ ویو جو ہمارا پروجیکٹ ہے یہ 3 ہیزرڈ آتے ہیں سال میں, جو ڈراؤٹ, ہیٹ ویو اور فلڈ. یہ ہمارا جو ڈسٹرکٹ ہے وہ جغرافیکل جو ہے نا وہ بہت افیکٹ ہوتا ہے. یہاں پہ ڈراؤٹ بھی ہوتا ہے, ہیٹ ویو بھی ہوتا ہے, اور زیادہ تر فلیش فلڈ اور ابراہیم فلڈ بھی آتے ہیں. تو ہم نے جب 2010 سے فلڈ آیا تھا تو ہم نے مختلف جو اوچھا کی میٹنگز ہوتی تھی ڈسٹرکٹ لیول پہ نا, تو اس میں جاتی تھی. اس میں کوآرڈینیشن میٹنگ ہوتی تھی ہر کلسٹر کی, واش کی, سوشل پروٹیکشن کی, اور جو مطلب ایجوکیشن کی, فلڈ ریسپانس کی. ہر کلسٹر میں جاتی تھی اور پارٹیسپیٹ کرتے تھے. تبھی اس میں ہماری جو ایک کوآرڈینیشن ہوئی, اور ڈونرز جو ایجنسی ہے یا اس میٹنگ میں ہماری کمیونٹیز بھی ہوتی تھی. تو اس طریقے سے ہماری جو ہم نے اسٹرگل کی, اور پھر ہمارے مختلف NGO اداروں کے ساتھ ہماری لائزننگ ہوئی. تو جب یہ ممبرشپ آئی, ہم نے ممبرشپ کی, اور اس میں اپرچونیٹیز آئی ہیٹ ویو کی یا
تو
بلڈ کی یا
ہیٹ ویو میں کیا
مطلب
کرتے ہیں آپ لوگوں کی مدد کیسے کرتی ہیں ہیٹ ویو میں؟
میڈم ہمارا جو یہاں پہ جو لیبر ہیں زیادہ تر فارمر ہیں, تو ہم ان کی کرائٹیریا پہ وہی آتے ہیں, کیونکہ گرمیوں میں وہ ان کی مطلب لیبر کم ہو جاتی ہے, ان کو مزدوری نہیں ملتی, دیہڑی نہیں ہوتی. تو ہم تھرو ہماری ڈسٹرکٹ گورنمنٹ سے ایک تو ہم نشاندہی کرتے ہیں کہ کن کن ایریاز میں ہمارا جو ہے وہ انٹرونشن کریں. تو وہ ہمیں وہ دیتے ہیں میپنگ کر کے, وہ ایریاز آئیڈینٹیفائی کر کے دیتے ہیں. پھر ہم ان سے NOC لیتے ہیں DDMA سے, گورنمنٹ سے. پھر ہم جو ہے نا انہی ایریاز کے فوکل پرسن ہوتے ہیں تو ان سے ملتے ہیں. وہ خاص طور پہ ہم خواتین کو کمیٹیز بناتے ہیں, تو ان کمیٹیز کے تھرو ہم ان کی وہ کرتے ہیں, اسسمنٹ ہم کرتے ہیں. پھر وہ کمیٹی آئیڈینٹیفائی کرتی ہے کہ یہ خواتین زیادہ تر جو ہم وہ کرائٹیریا میں خواتین کو وہ دیتے
ذرا
ہیں جو وہ
ہیٹ ویو
ہاؤس ہولڈ
والے
ہوتے ہیں.
کیمپ میں کیا کرتے ہو جب تمہارا
کیمپ میں
کیمپ
میڈم
لگا ہوتا ہے
اچھا
ہیٹ ویو کا ٹینٹ جو لگا ہوتا ہے بوتھ, اس میں کیا کرتے ہو؟
کولنگ سینٹر, اس میں میڈم ہمارے 5 کولنگ سینٹر تھے ہیٹ ویو میں, جس میں خواتین آتی تھی. وہ ہمارے RSC تھے, کمیونٹی رورل ہیلتھ سینٹر. اس کے باہر جو تھے نا وہ فوکل پوائنٹ تھے, اس میں ہم نے ہیٹ ویو کے کولنگ سینٹر بنائے تھے, جس میں یہ کولر تھا, پانی کے کولر سے, شربت تھا, ایئر کولر تھے, پنکھے تھے. ہماری ٹیم بیٹھی تھی. وہ جو خواتین گاؤں دور دراز سے صبح کو آتی تھی ہاسپٹل میں, یا ایون مطلب شہر میں آتی تھی, یا نادرا میں وہ اپنا CNIC بنانے آتی تھی, تو ہمارے کولنگ سینٹر میں بیٹھتی تھی. وہ تھوڑا وہ اپنا گرمی کا ٹائم ختم ہو جاتا تھا تو سانس لیتی تھی اور اپنے آپس میں گپ شپ کرتی تھی. اور پلس یہ بھی میں نے دیکھا کہ اس میں جو ہے نا اپنی ایک مطلب گیدرنگ ہوتی تھی. اور میں خود کولنگ سینٹر میں جب گئی تو وہاں پہ وہ اپنے جو ہے نا مسئلے جو ہے نا وہ مجھ سے شیئر کر رہی
اوکے,
تھی. ایک یہ
سو
5 ہم نے
ایکچولی
کولنگ
کولنگ
سینٹر
سینٹر جو ہے نا وہ ایک نئی چیز ہے نا. In many districts, we don't have cooling centers. It's a new thing. So that's why I was asking, what is a cooling center and how do you do it? So I'd like to welcome Saima from Vihari and Sugra and from Dadu, and who else has joined? Our friend from Rwanda is still with us. I don't know if you would like to say something at the end. Azka from AJK or
Assalamu alaikum.
Walaikum salam. Welcome. I think everyone is very happy that you could join us today. So now we are in the last 10 minutes of our webinar. So I would request everyone to turn on their cameras so we can take a memorable picture. And also tell us one, oh wow, look at all these districts who have joined us. Thank you. I should turn on my camera. So I think Bahawalpur wanted to say something. Nasreen, did you have your hand up now or before? And I would like to ask
Now.
Hira Imam. Hira, what would you say about schools? How to help children and teachers during disasters? Because schools are very affected. We have two representatives from Gilgit-Baltistan, Miss Ayman from Gilgit and Miss Tahira from Hunza. And we all know that Gilgit-Baltistan is beautiful, but it also has a lot of disasters. We have Miss Zahra from Islamabad. So whoever shows their picture, I will tell their name. That's the trick. Okay, G, Bahawalpur. Or Hira, who wants to go first?
जी पहले मैं बोलूं या मिस हीरा बोले?
आप बोले जल्दी से.
अच्छा मेरे सवाल क्योंकि पहले से हम बात कर रहे थे कि हाउ कैन
कैमरा ऑन करके बोले
उसमें
ना.
मेरी जो एक मैडम मेकअप नहीं आज.
अच्छा चलो. Next time with makeup.
Okay, you're there. Good. Shabash.
जी.
अच्छा जी मैंने जो अपनी गुजारिश की थी वो ये थी कि मैडम ने सवाल किया था कि हम कैसे इसको बेहतर तरीके से कर सकते हैं. तो मेरा यह ख्याल है कि सबसे पहले जिस भी एरिया में हम काम करते हैं तो वो बेसिक जो होता है वो डाटा कलेक्शन होता है कि हम वहाँ पे जहाँ पे किसी की भी खिदमत को करते हैं तो उस खिदमत से पहले हम डाटा कलेक्शन करते हैं. वो नीड बेस्ड होना चाहिए. वो कि हम फीमेल को बहुत ज्यादा प्रेफर करते हैं लेकिन बाज दफा मेल भी उस कम्युनिटी के बहुत ज्यादा विक्टिमाइज होते हैं. तो हमें सबसे पहले डाटा कलेक्शन करनी है कि कितनी आबादियों को हम इसमें फैसिलिटेट करें. उसके बाद हम अपना जब डाटा एनालिसिस करेंगे तो फिर हम उसमें जो डिजास्टर की टाइप है उसके मुताबिक हम अपने अरेंजमेंट करेंगे. उसके बाद हमारी कोऑर्डिनेशन जो है वो इंतजामिया के साथ भी होगी और कम्युनिटी के साथ भी, ताकि हम अपने जो ग्रुप्स हैं उनको बना के और फौरी तौर पे उनको हेल्प आउट कर सकें जो वहां पे जिनको हम फैसिलिटेट करना चाहते हैं. अब जहाँ पे हमारी बात आई थी नीड बेस्ड की, तो फीमेल की नीड्स बहुत ज्यादा हैं लेकिन बाहर जगह पे हमने देखा है कि पर्सन विद डिसेबिलिटी की नीड फीमेल से कई गुना ज्यादा बन जाती है.
ठीक है नसरीन, थैंक यू सो मच. आई थिंक यू रेज्ड अ वेरी इंपॉर्टेंट पॉइंट.
क्लोज करी हूँ. तो मेरी ये दो गुजारिशात थी.
वीडियो नहीं बंद करें नसरीन.
हाँ, वीडियो ऑन रखें ताकि हमारी ग्रुप फोटो बन जाए. नसरीन raised an important point that it's important to do data collection because data collection not only helps us with the current situation, but it also helps us to prepare for future. And data collection also tells us that there are people who are doubly discriminated because of gender or other ethnicity or disability who need special attention and need urgent attention. Hira, are you ready? Okay.
सब लोग वीडियो प्लीज ऑन कर लें ताकि हम मैडम एक्सीलेंसी मिस फातू के साथ एक ग्रुप फोटो कर सकें. इट्स अ रेयर अपॉर्चुनिटी.
Miss Fatu, I think you'll have to say hello to everyone and show your picture because everybody wants to see you. What happened?
वेलकम मिस फातू.
अस्सलाम वालेकुम.
मैं आप सबको अनाउंस करना चाहती हूँ कि आज हमारे साथ रवांडा की हाई कमिश्नर एम्बेसडर हैं मोहतरमा हरीमाना फातू और वो हमें अपने ऑफिस से ज्वाइन कर रही हैं. वी वेलकम यू एंड इनवाइट यू टू से अ फ्यू वर्ड्स.
Thank you so much. You hear me?
Yes.
Okay. Thank you so much for giving the floor It's my pleasure and honor to be with beautiful ladies like you, just to discuss about these issues. And as a new ambassador, High Commissioner of Rwanda, I think I get some experience from you, and I'm looking forward to continue this good program. Thank you, Madam Chair of PODA, to introducing me, my colleague, ladies across of Pakistan. I saw many people from Bhutan, from Karachi, and so different places. When I will visit the place, inshallah, I will just interacting with you as a beautiful ladies, and I'm happy. Thank you.
Thank you. Thank you. Merci beaucoup, Madame. I would like to tell my friends that Rwanda जो है वो इस वक्त दुनिया में जेंडर इक्वालिटी का नंबर 1 कंट्री है. रवांडा में 60% औरतें पार्लियामेंट में हैं. तो इनकी पार्लियामेंट में औरतें ज्यादा हैं. क्लैपिंग हो जाए.
So we should learn from their experiences that how they did it.
Yes. So, and I also want to announce you that very soon we will have Her Excellency, the High Commissioner, in the webinar. She will be our speaker. And you will all listen to her. She will share the story of women's empowerment in Rwanda, how from a very difficult situation, very painful situation, Rwandan women came out and they have empowered themselves. So please look for the announcement, and we will have Her Excellency, because Rwanda really is the success story of Africa, and I wanted to share it with all of you. So I invited her today so she can see the webinar, and we'll have her very soon. Thank you. So in the last few minutes, why has Ambereen and Nabila and Kashaf and Shamim not turned on their camera so we can have a memorable picture together?
Everyone, turn on
We'll
your
have-
cameras.
And I also want to thank Miss Hadia very much for this excellent webinar. No, really, it was so informative. It was so well organized. And the way you explained things, I found it very useful. I learned a lot from you. We thank you very much, and we wish you the best for your next assignment to Somalia. And once you're there and you settle down, we'll ask you to talk to us again and tell us about Somalia, because we want to start a series of also learning about different countries. So first we'll learn about Rwanda, and then we'll learn about many other countries, because, you know, we are a global community. So the more we learn about other countries, the more we understand the situation of women in other countries. We can also learn from their examples, and we can also share our. Pakistan also has a lot of success stories, so we can also share that. So with these words, I want to thank.
कैमरा ऑन नहीं हो रहा.
Shamim ka camera on nahi ho raha, and so I would give the floor back to Hadia to give her concluding remarks. And once again, is our board member with us? Dr. Asker still here?
Hardy and Lahore.
नहीं, वो हमारी Dr. Asker, I wanted to ask her to say a few things, but I think she left. He does amazing work
if you
on
can be
women's
very
health.
quick, we want to just take a snap Vihari, you'll have to show your face before you
It's
ask.
okay. No, we don't ask any. We don't, don't have to. It's a
Okay.
volunteer thing. If somebody wants to show their face, it's okay. It's not compulsory. So it's a choice. If people want to have a picture, fine. If they're not comfortable, that's okay. Ji, Hadia, please, your concluding remarks.
कुछ कहना चाह रही थी, हाथ खड़ा हुआ है। कमल, वकार, आप कुछ कहना चाह रही
नहीं,
हैं?
वो पुराना हाथ खड़ा हुआ है। साइमा,
Legacy
मैडम
hands,
मुझे कुछ कहना है।
अच्छा
मैडम
जल्दी
समीना
बोलो।
मुझे कुछ कहना
You see, you
है।
all come at the last minutes. Why were
कहना
you
तो
not?
चाह रहे हैं, but it's okay if we don't have time. That's
No,
fine.
no, it's okay. We'll give you 1 minute. Ji.
मैडम समीना, अस्सलाम वालेकुम। साइमा बतूल बात कर रही हूँ विहाड़ी से।
आज ठीक है, बात करें। वेलकम।
मुझे आज के वेबिनार में, मैं तो अभी पहुंची, मैंने कुछ नहीं सुना
जल्दी आया
क्योंकि
करो ना।
मैडम सुन लें पहले। आपके लिए गुड न्यूज है।
हाँ।
मैं डिस्ट्रिक्ट इलेक्शन कमिश्नर की मीटिंग में थी ईसीपी ऑफिस में, और उन्होंने मैं ऑलरेडी मेंबर हूं जब से डीवैक्स बनी है तब से, लेकिन आज मुझे ऑन द बिहाफ ऑफ पौधा बुलाया उन्होंने। और उन्होंने
वेरी
मुझे
गुड।
मैं चाह रही थी कि ये शेयर करूं, और उन्होंने मुझे ये कहा है कि आपका जो है ना, अब हम आपकी सुधार को नहीं जानते, हमने आपका नाम जो है वो एज पौधा मेंबर लिखना है।
थैंक
और
यू।
अभी
कोई बात
ये
नहीं।
और
तो बड़ी
उन्होंने ना,
अच्छी खबर है।
और दूसरा
Alright.
ये कि जो हम डिस्ट्रिक्ट लेवल की कंसल्टेशन कर रहे थे मैडम नबीला वाले प्रोजेक्ट में, तो मैडम हीरा इमाम अगर सुन रही हैं तो उन्होंने सियालकोट में शायद काम किया या शेखुपुरा में, जो हमारे डिस्ट्रिक्ट के इस वक्त के सीईओ हेल्थ हैं। जब मैं उनके पास गई और मैंने पौधा का नाम बताया, उन्होंने कहा कि मैडम हीरा इमाम ने इतने अच्छे से हमें ब्रीफ किया, हम तो पौधा को बहुत अच्छे से जानते हैं, आपको किसी एनओसी की जरूरत नहीं है, आप आए, हम आपकी खिदमत के लिए हम हाजिर हैं। मुझे
बहुत
ये दो
शुक्रिया
गुड
very
साइमा।
nice.
ये बस मैं
Thank you for
इख्तितामी
sharing
कलिमात
these
बोल
two
दूं।
good
Thank you.
news. Thank you for sharing these good news.
Well, I'll
I will
request.
translate it for Madame Fatou that today she has become a member of the district election board. And last 30 seconds to Kamal.
Yes.
Oh, thank you so much. So I just quickly wanted to first of all appreciate to you and Hadia for this excellent seminar, and thanks to Fatu for joining us here. My only point is that when we are talking about collection of the disaggregated data, then we should raise awareness of these DDMAs, PDMAs, and NDMAs with having these facts and figures, that why we are asking about gender responsive risk and management plans.
Very
So
good
thank you and
idea.
looking forward.
Thank
Yeah,
you.
looking forward
Thank you.
for more.
Very valuable. Let's do it first.
Yeah.
Let's show them that we can do it so they can do it. Let's not wait for them to change their database. Let's change our database. So with that, I would really like to thank everybody जो आज की महफिल में आए, वेबिनार में आए। उम्मीद है कि सबको फायदा हुआ होगा, कुछ सीखा होगा। और इसकी रिकॉर्डिंग आपको पता है कि अवेलेबल होती है, उसके लिए वाजिद से आप राब्ता कीजिए, वेबसाइट पे
Thank you to Wajid and all the Poda team. And our time is
Welcome,
up.
madam.
So big clapping for Hadia, and thank you, and have a safe trip. And we will talk to you from Somalia in a few months.
Inshallah, inshallah.
Thank you. Khuda Hafiz, everyone.
Bye.
Bahut
Allah
shukriya.
Hafiz. Amazing.
Thank
Bye.
you. See you next Wednesday.
Bye.